One of the more specialized blood collection techniques is the collection of arterial and capillary specimens for blood gas analysis, performed by respiratory therapists, phlebotomists, and other healthcare personnel. Blood gas results provide physicians with meaningful information about the respiratory and metabolic status of their patients. Because a puncture to an artery or arterialized capillary bed is required, this procedure demands extensive training, knowledge, and skill on the part of the collector. In this video, we will discuss proper arterial and capillary blood gas collections according to the clinical practice guidelines of the American Association for Respiratory Care, AARC, and the standards established by CLSI, the Clinical and Laboratory Standards Institute. With the information presented here, you will be able to demonstrate the proper procedure for safely obtaining arterial and capillary blood specimens, describe the complications commonly associated with arterial collections, and prevent collection and transportation errors that can alter test results. Performing arterial and capillary punctures requires comprehensive training, which should include detailed instruction on respiratory physiology, anatomy, site selection and preparation, pre-analytical errors, and the risks associated with such collections. Collectors should follow standard precautions throughout the sampling and handling of blood gas specimens as prescribed by their institution's policy.
Many of the patients that have need for blood gases usually are in intensive care units, and this information will allow the physician to actually treat an imbalance either in what we call respiratory or metabolic alkalosis, acidosis related to pH, related to the oxygen content, carrying capacity of the blood, and related to the carbon dioxide release and uptake. The patient, if it's related to respiratory, then the patient is on a respirator. The patient can indeed be manipulated so that they can either increase the amount of ventilatory capacity that is needed for that patient based on the blood gas analysis, or they can decrease it, or as you say, they can attempt to try to wean the patient by looking at multiple samples serially down the road with each change in the ventilator.
The three acceptable sites for arterial blood collections are the radial, brachial, and femoral arteries. Because of its location, the radial artery is the most frequently used. Its relative close proximity to the surface of the skin makes it easy to detect, access, and apply pressure to once the puncture is complete. Another benefit of this site is the collateral blood flow provided to the hand by the ulnar artery. To locate the radial artery, apply pressure using your index finger and locate a pulse. Typically, the radial artery lies close to the wrist in the depression between a tendon and radius of the lower forearm. Keep in mind that detecting a pulse may sometimes prove difficult, as with obese patients and patients experiencing low blood pressure or a weak pulse. Due to its depth and close proximity to nerves, the brachial artery should be considered as an alternative site only when neither radial artery can be confidently accessed. In such cases, evaluate the brachial artery in each arm to determine the best choice. In comparison to the radial artery, the brachial artery is larger and generally has a stronger pulse. However, disadvantages associated with the brachial artery include a lack of support by tendons and bone compared to the radial artery, the absence of collateral circulation, a higher risk of injury due to its close proximity to the median nerves, and an increased risk of hematoma formation due to its depth. The femoral artery may be used to obtain an arterial blood specimen when neither radial nor brachial access is an option, as during CPR. Located in the groin area of the leg, punctures to this site should only be performed by a physician or qualified emergency personnel trained in this procedure. According to the AARC guidelines and the CLSI standards, arterial punctures should not be performed on radial arteries where collateral circulation to the hand cannot be established, through lesions, infections, or distal to a shunt, or on patients with a coagulopathy or who are receiving medium to high dose anticoagulant therapy.